Hello, I'm Monika White. I'm a graduate of the USC School of Social Work, both for my master's and my doctorate. I'm a former president of the California Social Welfare Archives and a co-founder of the California Social Work Hall of Distinction. I'm a retired associate professor here at the School of Social Work and the School of Gerontology, and the former president CEO of Center for Healthy Aging in Santa Monica, California. Today, I'm very pleased to be interviewing June Simmons, who was just last month inducted into the Hall of Distinction. And today we will find out how she got here and why, and find out what she's up to now. Welcome, June, and congratulations on your induction into the Social Work Hall of Distinction here in California. I know that for the last 20 years or more, you have been the president and CEO of Partners in Care Foundation, but let's go back a ways and let me find out, first of all, how is it that you became a social worker?
Well, when I was first out of college, one of my early jobs was with the YWCA, and I had many opportunities learning with them, and they guided me when I said, I think I need to know more in order to be effective in my work. They recommended social work and helped me find the best schools and actually gave me a tuition scholarship. And so I was lucky to go to USC, and it was a great program.
Well, you answered my second question, which was, what influences led you to the field, but you already said working in it, essentially. What was it like when you came into the field? What was, for a social worker, what was the climate, the social, economic, political climate at that time?
It was a time of transition, maybe like now as well, where we were beginning to discover the importance of diversity, the differences about people's experiences from different racial and ethnic groups. So it was a time when Black rage was an issue, when women's groups and Black groups and other kind of identity groups were forming, and we were moving out of a time of extreme political correctness, which in the old days was much stronger than what we think of now, into people seeking empowerment and significant social change. So it was an exciting, positive time.
A little bit like today.
A little bit like today, and we did have the Watts Rebellion, and we had major kinds of expressions of distress and concern in the streets about injustice, and so it was a great time to learn and to discover as we began to evolve into the most wonderfully diverse city in the world, I think.
Yes, I think so too. Well, hopefully we can contribute something to the future based on our experiences of that time. Talk a little bit about how your career developed from when you first came into it. What was your focus? What kinds of positions you have held, and what kinds of activities you've been involved in? I know that's a long story, but we're interested.
Well, I did start with the YWCA as my first professional position, and they had very strong national training opportunities, so it was an opportunity to see role models, because I'd never met a social worker that I knew of. I came from a small town, I'm a farm girl, so seeing the city through people's eyes and seeing the kind of leadership women could give, because YWCA very much was focused on empowerment of women in leadership roles. That was a great grounding, and they taught me to identify unmet needs and develop solutions to them. So that turned out to be a broad theme for the rest of my career, the rest of my life. Some places you learn to be specifically skilled with one thing or another, but this is a very broad level of inquiry about how can we make a community and a person's life better, and that's kind of what's driven me. So I went back there after graduate school and worked on their early adoption of addressing what they called the one imperative, to eliminate institutional racism wherever it exists and by any means necessary. So a young white girl, I was given the opportunity to develop training and other kinds of work around that. So that was a grand adventure, and then I moved on to Huntington Hospital. Just through a chance, I entered health social work practice. Didn't know a thing about it, so it made me a good learner, and developed the social work program at Huntington Hospital, and then later with you developed the senior care network at Huntington Hospital, which was an early solution to seeing unmet needs. Why did people end up in the hospital who shouldn't have? Why, when it was time for them to leave and have care as frail older adults, there was no way to pay for it and not a right place to go. So I developed a passion about end-of-life care being better, about managing health care better, and about long-term care resources and payment being transformed. So that's why we did Senior Care Network and developed that in the 80s, and there it is. Still successful, and they're doing a good job.
Very innovative program at the time, and I think a model
yes.
For the rest of the country and even other countries.
And it's still innovative work now. Yeah. That model is a lot of what we do at Partners in Care on a more regional scale. So that led me into the administration. I had role models in the East where health social work practice was so much more mature and established, and I could see that it might make sense if you want to influence the design of the system so that it works better for people, that you should be at the table. And so out of the Senior Care Network experience, I began to have the opportunity to advance and become part of the administration of the hospital itself. And so that was a great education in healthcare finance, healthcare change, resistance to change, opportunities. So, and out of that, then I was later recruited to the Visiting Nurse Association, where a lot of people think I'm a nurse because I ran the Visiting Nurse Association. I went as the chief operating officer, so I entered the C-suite and later became the CEO. So that was a shock. Nothing ever, necessarily set out to be a CEO. You just set out as a social worker to see what platform can you use to achieve change in the resources and the systems that can harm or help people. How can you make them less harmful and more helpful? So that's kind of my driving ambition across all of this. So the Visiting Nurse Association was another great education and opportunity. So still a focus on, at Huntington I was focused on people leaving the hospital, being safe at home. The visiting nurse was caring for people at home, and so then out of the visiting nurse, we decided to found Partners in Care Foundation about 20 years ago, a not-for-profit, and it's focused on changing the shape of healthcare. Small agency, looking at the fact that America spends so much more money than any other country in the world and comes in so low in our outcomes, whether they're prenatal care or how we care for elder lifespan, ethnic disparities, all these nearly criminal disparities in outcomes. It's it's embarrassing. And so we want to move the cheese, you know. We were founded to see if we can find a way to take the money in America as it's spent disproportionately on fee-for-service medical interventions and move some of that money over to social services. That's what the other developed countries do. They have a much better ratio between social services and medical investments, and they get better lives for better people by keeping them more well and therefore avoiding the most expensive healthcare settings. So that's our path, that's our story, and we're sticking to it. We've been doing it for a long time. We start out with end-of-life care and home palliative care at home, and moved into nursing home alternatives, and then how do people avoid being readmitted to the hospital? How can they be empowered to manage chronic conditions and the risk of falls and the risks and stresses of caregiving in order to get better health outcomes and better quality of life for themselves.
It seems like you really went on a trajectory, a path, and it sounds really that you clearly could see what you gained along the way from each of your positions and the agencies that you worked in. It's really great. What would you say were some of your strategies for accomplishing the goals that sound very clear when you say them along the way?
Well, looking at win-win solutions for change. So trying to find out whoever has the money and the power to make decisions that would change systems for the better, how does what we have serve their interests? So early on I looked at the hospital, I said, wow, you know, I want them to really be nice to people and meet all their needs. They should invest in that. But they have to keep their doors open. They have to be successful. So I very early on became obsessed with cost benefit to the change maker. How is it that it's a win-win so that we can really have a way to help people who can't do that for free and have that benefit. So those strategies change over time, but in essence, my whole life, that's what I've been working on. So little changes like bringing child development specialists into pediatrics, and maybe instead of going on gurneys and having to be abandoned by their parents to go to surgery, kids going in red wagons and their family staying with them till they go in. How does that benefit the hospital? Maybe it stops the screaming and the terror. Maybe it stops lawsuits and anger. Maybe it enhances donations. Maybe it enriches the frequency of use of that hospital and its reputation. So all along looking for the ways that social work solutions to real problems people have, when those are solved by someone else, they let us do it, they pay us to do it, they win. So you and I, we worked on senior care. We helped the hospital see they could attract more Medicare patients. They could attract donors. Older people have estates. A whole range of, they could make better use of their beds, and their payer makes their client mix. So that's kind of my core strategy, and then doing that through voices in those other sectors. We got senior care because the chief medical officer decided that we had the winning strategy and we should be able to receive a large bequest that funded the start of Senior Care Network, because he came to believe in these ideas. So talking with people, we got social work in the emergency room 24/7, because the chief physician agreed that there were an awful lot of social problems that were really being neglected and that were driving inappropriate repeat use, that were distracting all the health professionals because they were having to focus on people whose needs weren't met and became disruptive, that all these kinds of features are of mutual benefit. And then whether it's a doctor, whether it's a tall white man, whether it's you know, the king of the universe, the queen of the universe, that other voices in other sectors who have credibility are critical to making change and to endorsing our social work ideas.
So your strategy of win-win, which I know you have continued on into your career, but you also seek a champion or someone that can speak and disseminate your idea.
Can explain the win credibly to someone else, because certainly once I started as a social worker, the hospital administration wasn't going to look to me as the authority. Consultants can do that. Anyone, a stranger 50 miles or more away, can be more believable than someone in the neighborhood. So a physician in charge of all medical affairs in a hospital is more believable than the social work director. Or a major donor might be, or a nursing leader, or someone else. So all of these, or the head of the ER says, I want these staff in my service. That's better than me saying, you know, they should have social workers over there. So it translates totally differently. So if you can get the win-win bought into by the right voices, those voices can make change better than us, and we can help them implement it.
That's a terrific guide and lesson for future social workers or those in school. Great. Sounds like you were always successful, but I suspect you faced some obstacles and challenges. Can you talk a little bit about that?
I'm still at it 40 or 50 years later. So what is success? I'm still working on the same problems, Monika. We've made some progress. Now might be the time. It's possible that America will bend the curve towards a more humane and person-centered health system now. You know, I think you take your successes one at a time. That it changes incremental. It takes longer than we thought. When I went to Huntington, I thought it would take 10 years because I'd been working on racism in the white community, and I realized there are forces of resistance. It's not so easy to just like explain things and have people go, oh, I see, and step up. So I thought in a conservative medical setting, it might take 10 years for social work to actually be understood and properly utilized. Turned out that was about right. So you have to be able to live with people kind of laughing or, you know, treating you as sort of an affirmative action result, or in some other way being misunderstood, but you have many signs along the way. So I think taking small successes and then of course anything that someone might call not a success, I would take as a lesson, and if it's on my path, I would probably say, so if someone says no, that's not the end of the discussion. I usually like to say no just means it's a much longer discussion than we were planning on, because no tells me what someone's objections are or what their needs are, or why it's not a win-win yet. So it's educational. So I don't feel too much about failure. I feel more about continuing to learn and wend my way.
And you have. What do you think was the most difficult experience in your career that you've encountered?
Well, I was at Huntington a long time. There were changes in leadership that made it so different. I thought that probably in those days you might stay in an institution forever, so making that change was a big change. But I knew when I went that the Visiting Nurse Association was not financially strong, but it was really not strong enough to stand safely. With 5,000 people under care at home, if you were to declare bankruptcy and reorganize, someone might die because you can't guarantee paychecks. So we felt we had to sell it to a for-profit. It was a 70-year-old, beautiful, important, not-for-profit delivery system. Watching healthcare take it apart, making it weak with the changes that they had, and then having to sell it, that turned out to be kind of, you know, a lot of positive change comes from a foot in your back, things you never wanted that push you in new directions and that are very positive, but I really wasn't on my wish list, so that was a difficult thing, but as we know, it turned out well anyway.
Yes. So it's really interesting to hear about some of the challenges that you have met. Let's turn it around and talk a little bit about what you think is your most satisfying experience in your career to date.
Wow, so many. Well, it's nice to see things still stand. Social work at Huntington Hospital, I put 20 years into Huntington Hospital, and when I left, social work was going to be endangered. I could see it's one reason I left, because some of the change in leadership, and now it's back and it's strong. Senior Care Network stands and it's strong. So those are very satisfying. But Partners in Care, the fact that it exists after 20 years, it's not huge, but it's grown to a reasonable size, but it has influence. We're labeled trailblazers at the national level, or considered definers of new models of care that we can create prototypes for and help scale. So we scale them enough? No. I look at enterprise in the financial sector and I see people bring inventions and and go out and scale them dramatically. So I'm watching that and thinking, we really need to learn that. I haven't quite learned that. Nonetheless, there are, we decide to build networks where agencies work together, so health payers could have one contract and get the whole system of social work in a community, or at least major parts of it. And that's scaling statewide across multiple states in America. So that's very satisfying to see. Seeing dramatic results. Maybe one of the most exciting things was getting CMS funding to try to reduce avoidable readmissions for Medicare patients that come out of the hospital, they get in trouble, they bounce back in. And to see that we could see 32,000 people and reduce readmissions by at least a third and save Medicare $16 million net, that was proof of concept. So now we're getting more results. We don't quite have them yet. I wish I had them for this. But I understand that we impact mortality rates at the end of the year, and that a single in-home visit by a social worker or a community health worker supervised by a social worker, with a few phone calls following up, evidence-based, very powerful, can reduce readmissions. So it means people didn't get sicker, get in trouble, call for help, go to the ER, end up in the hospital, cost $20,000 when they could have recovered at home. And at UCLA, dropping those readmissions for high-risk people by 2/3 with that kind of a model, with a little more robust social work than the 30% with less social work, 60% with more social work. Yes, so proving things. You're a researcher. Yeah. As you know, I'm not a researcher, but I love metrics. I want a value proposition. I want to prove that if you spend this money over here, you get these savings over here, and lives are better. You can't afford not to give the right care to people. So that lights my fire. If I were watching myself, I'd say she's excited about it.
It is exciting, June. It really is. Well, you've been around the field for a while, social work, and can you talk a little bit about some of the changes that you've observed in the broader the broader picture, social, economic, political, and so forth, changes over the time you've been working in it?
Well, I think we're in a resurgence, a recognition of critical value of social work as a profession and social interventions as essential. we, in our time, saw social work pretty respected in certain ways, but not massively scaled. And now we see medical groups hiring social workers, hospitals hiring social workers. They're a little harder because of the interdisciplinary, but still. Health plans hiring social workers. We're seeing new understanding of the issue of homelessness. Different perspectives even on diversity, racial diversity, and the impact of the experience people of color, what their daily life experiences drive, where mental health issues come from, what might cause depression in people, what the impact of poverty and violence and war, what PTSD, how widespread it is. So we see discovery. So to me, we had a tremendous knowledge and skills always, but to be impacting into a broader society. So now it's on us to be great, to each do our best so that we really don't lose the moment, because moments come and go for change. So I don't know if I'm answering the question.
Yeah, and
how has social work changed? The context is
the
changing, and a lot of it comes from measurement. This powerful ability to measure and demonstrate prevalence rates of these problems, differential outcomes from differential life experiences and care systems, differential costs by doing or not doing something. That I can say Medicare can save $16 million by having us serve 32,000 people. We could not have done that. Yeah. Now, in the age of technology, we have some ability not only to capture data, but you fancy researchers have incredibly sophisticated ways now to actually measure and credibly tell us, so that we can try to reach agreement about what needs to be solved. Now, America's split on some of this, but these are tools. These are like cannons instead of BB guns. These are like massively important pieces to have for change making, which is, I guess, what I'm about, is trying to make positive change.
I think so. Yeah. and you've kind of started to address my next question. You've raised some of the issues that social work should be addressing and how we might go about doing it. Can you talk a little more about what are some of the big issues and how can we deal with them?
How can we deal with them? Well, people have to pick a lane and take their lane, because I've always thought there was limitless human need and suffering. So you could pick anything and you'll be worthwhile. So I picked healthcare, but it didn't really matter to me at the hospital which population, because I could be opportunistic and say, okay, right now they want to start a neonatal intensive care unit. I can get social work to grow and be established and demonstrate its value by riding the horse that down the trail they're taking it. So I think that's true now. So healthcare is critical. It's in a fluid moment. If you think about earthquakes, liquefaction occurs briefly and things can shape and reshape. The changes like that. And moments come when things are more fluid. People's assumptions, their positions they're stuck in, get blasted. They're open a little bit. It's like crisis theory, crisis intervention, same thing with individuals. So right now we're in some fluid moments. So in a given community, whatever someone's issue, heart, and expertise is, social work can do that. We can do it in the street. We can do it in institutions. But I think instead of when we went through, there was a lot of focus on private practice. I have private practice. I'm in favor of it. It's important. But the ability to use the social work perspective for broad social change, reorganization of our institutions, reallocation of our resources to reduce avoidable suffering, optimize people's lives, I think, you know, that's, to me, that's what draws me. People can do it at any level. And we had social workers at the hospital who created the child abuse team that we hadn't had before, or that decided we should have red wagons to take kids to surgery, you know. So the clinician, that we should have a viewing room so people could actually say goodbye to their loved ones if they lost them. Those changes at the line are powerful, and some big system-oriented people like me, you know, I can't make those. I can make them possible. I can support them. I can encourage them. I can say, pick your own. Everybody make one. So I think that people should be doing what they do one by one, but with a view to system.
One of the things I've always loved about social work is that we really can be anywhere.
It's so big.
And accomplish something.
Yep.
At any level, large or small. I think it's a really potent,
That's true.
powerful place to be.
It is. It's a fabulously versatile career. I certainly didn't start out for aging. You know, I started that in the 80s, and I was with the YWCA, and then I was looking at ER social work, and I was looking at neonatal or rehab or med surg, or how do you change a hospital's understanding. And then we looked at rape as an early issue, child abuse became an issue, all these things that became issues, drug dependence, homelessness, they're all shifting, and so pick your passion, you know, go where your heart is. That, I guess that's what really draws you, you know.
Well, I think you're a great model of what a social worker can do. That's why I said about you at the induction, you're the social worker we all like to be or aspire to be, because you really have taken those skills and utilized them in major ways.
It's a big compliment from an accomplished person like you. Well, the thing I did was I didn't let fear, I wouldn't say I didn't let fear be my guide, I didn't let fear stop me. At some point I came to hold fear in safety and let it lift you. Because I had terrible stage fright, speaking in public. I got over that.
So you've raised a lot of issues that have been worked on and will be worked on, and a little bit about what should we be doing. And I just wonder if you have any other advice about how we can, you know, be involved and make things better.
We social workers?
Yes.
Well, we've got to be purveyors of hope to whoever we touch. We have to help people learn to vote. We have to help people learn how to manage differences of various kinds, gender, ethnicity, you know, racism is now so obvious. Maybe it's easier or harder to deal with, I don't know, but it's so profound. The threat to our democracy is so deep, and yet we have a lot of opportunity, because of the turmoil. I wouldn't want to send any compliments about the turmoil, but there are disruptions occurring, both good ones from measurement and bad ones from fear. And if we can take that fear and convert it into something positive, that to me is a guiding principle in life. There has to be a way to, if you're going to have the pain, you need to get the gain. And so those can drive social work practice to solutions like the homeless. I think we'll see transformational work around the homeless. We need to make it succeed. The fastest growing population of homeless now, older people. Why? Because capitalism is blasting them out of their homes. there they are. There's two of them, and one dies or goes to the nursing home. The other can't pay the rent. They have medical bankruptcy. They have some horrible drug. I have a neighbor who suddenly his medication, one medication went to $4,000 a month. People are, so our society must really step up, and we must really step up to address the kind of opportunities these breaking point in problems can offer us. I don't know if that answers.
No, it does, because you're saying while we all have our interests in social work, perhaps population or some target issue, we really need to open our eyes and see the bigger problems.
Yeah, in the world there's a move towards dictatorships, and we need to be on guard, because that would interfere with all these positive reforms we're talking about. So I think at a very macro level, it's critical to reach out and inspire. We have a hall of distinction. We need in it to be using it. We were talking about it afterwards, saying, well, these are about long lives that have been lived with some good fortune and some good outcomes, and so they're useful as role models. We need to use that to inspire, to actively have the inspiration side of that, because it's the people behind us. Michelle Obama was just interviewed, and she says what gives her hope is the youth rising and leading and investing there to, I'm still serious about aging issues, and I do a lot of work in the casualties of age and disabling conditions, but the leadership of the future is so important. So social work education, but even this effort to lift and share wisdom and inspire new people who are crazy driven to make positive change and enjoy the process. Well, because it is fun. If you're optimistic, you just say, well, it just takes what it takes whatever it takes, so just do it and enjoy the process. So,
well, your career is so impressive, and I think a real model for others. Looking back, is there, if you could do it again, is there anything along the way that you would do differently?
Well, I guess I'd be more skilled sooner. I'd do a better job of getting more champions. I would seek more private resources to lift up more voices to the work. So I'm working on that now. How can we obtain private sponsorships? Look, we're in the Suzanne Dworak-Peck School of Social Work. Wonderful. What an investment, So some of my work, I should seek investors to stabilize it for the long term and to lift it in the short term. So I think that's an area where I need more skill, and I'm getting some strength in my team to wind me up and send me out, and to surround us with new and broader champions. Because this is a time to seize. Probably every time is a time to seize. There's a horse going by and you better ride it. It's going somewhere good. So I want to be sure I don't miss that horse or that boat, so to speak.
Or that train.
That train. That train.
Yeah,
that's right.
That train. Yeah. So from talking with you today, there's a lot that can be learned from your experiences. Thinking about people entering the field now, can you relate what you've done and your experiences that would guide them perhaps in their future? And you've touched on it throughout.
Well, it's like when I went to college, and at that time women didn't have so many options, and I thought I will do well at learning and what I care about. So I just went through the catalog and checked off everything I liked, and that's where my major fell, wherever there were the most checks. So I've lived my life that way, saying, follow your heart. Find a vocation. And you have, well, maybe need to make a living in the course of it. Don't let it be a job. Find the piece that lifts you. Find the innovation that comes from the work you're doing, and work for some piece of change, some size of change beyond what's just assigned you. And and then bring the stories forward. I've worked hard on metrics. I've been short on real stories, although I guess I'm known for my metaphors, my colorful examples. But some people really tell stories much better, and I think we have to tell the stories of the people we see, whose lives need to change, and whose lives do change because of what we did. We need to show what it is we do and why it matters. So all of those you can do as a new grad, or even if you just don't even have your MSW, but you're en route somewhere. But I think just believing in positive change is the core, and the change you care about. That'll be good enough, whatever it is. That'll lift you. That'll be your purpose. That will drive the joy in work. That, I think, is you'll see. I have the honor to be in the Hall of Distinction, but I am no way done. And I'm old enough to be done, but I am not done. So I'm fully charged. So I think it's a good way for people to live. I think new people coming out, find what energizes you. You did the same. You do what is a natural caring for you, and it will lift you, and it will lift your work, and it'll lift your life. It's lifted mine.
Indeed, and others with you. One last question is there, do you have a wish? I wish someone had told me that somewhere along the line. Is there something that you wished you had known, or someone had said, do this or watch out for that, or?
Well, there's administrative things, certainly. So maybe it would have been good to have more education around financial management, or scaling companies, institution building. We've had a nice effect, but maybe we could have a bigger effect if I either had more knowledge, or I found people, like when we did senior care, you had skills and knowledge. I didn't have any of it. We each had ours. And thanks to yours, the whole core, the foundation, the knowledge of the MSSP, all of that whole piece, it really was an advancement. So should I have had more business skills? Do I need them now? Some of those, so a range of other skills, I would say, to get greater investment and greater impact, because, you know, if it's good, why not more?
Well, there's some implications for social work education.
Sure.
Certainly.
Yeah, I didn't understand cash flow. That almost cost me a few times.
Yes.
If you're building something, you're investing on the front end. If you don't have enough cash for that, your work can be in peril. So simple things like that, and measurement, which I'm not so great at. Luckily, I know people who are.
Well, that's
so I think that, yeah, to know the range of skills that are essential, and to find a way to engage them. It's more than the voices for change. I started out with champions.
Yeah.
There's expertise, there's other skills that are crucial.
Well, June, considering that you know people will be seeing this interview and learning from it, that students will definitely in their research, be looking at the social workers in the Hall of Distinction to learn from them and to see, I think, what's good social work. Are there any other comments or anything you'd like to share as we conclude this interview?
Well, I hope people will go to the website and look at picf.org, Partners in Care Foundation's website, to follow the evolution of this work, whether I'm there or not, and maybe pick other change sites that are useful to them, because, you know, where we are today, things keep unfolding. But the main thing, I think, is to believe that positive change is not only possible, it's a moral imperative, and it's a privilege, and it's people worry that things will take more than they have to give. And I think that the fact is that we always find a way to redistribute and restructure and redesign. When you're single, how could you possibly be married and have children and still have a life, you know, and a career? And people find ways. So I think people should simply see their passion, follow their passion, and let it carry them, and let them carry it where they can, because it's a great way to live, and that kind of joyful pursuit of the good is irreplaceable in life.
Excellent. Thank you so much for taking time out of your busy schedule to talk with us.
What a privilege.
Thank you,
Thank
June
you,
Simmons.
Monika White, Dr. White.